Today, we're talking about the concepts of sensitivity and specificity in psychological testing. Let's go! Welcome to the channel. A quick note before we get started. Liking, subscribing, and commenting really helps us out. So if you've got a second, toss us a little sexy nod while I give you the 411 on sensitivity and specificity. Psychological tests are really important in diagnosis of mental disorders. If you're seeing a clinician for depression, you might take the Beck Depression Inventory. For PTSD, you might take the PTSD checklist. For anxiety, you might take the Hamilton Anxiety Scale. If the doctor suspects schizophrenia, you might complete the Brief Psychiatric Rating Scale, and so on. For every disorder, there are a multitude of tests that can be used to aid in diagnosis, either providing evidence for a certain issue or eliminating the possible alternatives. Generally speaking, no one test is perfect, and tests are used as just a part of the whole clinical picture. Now, just a quick note on language here. I'm going to use the word disorder to keep a lot of things simple, but up front we should acknowledge that this word does not apply to every diagnosable condition. Recognizing that these tests are not 100% perfect is important and means that every test that is developed has to be researched scientifically to determine how accurate it is. On the surface, it seems like you might just ask, well, if I scored a 35 out of 80 on this test, what are the chances that I have an anxiety disorder? As it turns out, it's a bit more complicated than that. There are two really important concepts that have to be considered when looking at test results: the test's sensitivity and specificity. To understand these concepts, it's useful to think about all the possible outcomes when you take a psychological test. If you're a statistics fan or have seen our video on type 1 and type 2 error, this will look really familiar. In essence, there are two dimensions to consider. The first is whether you have the disorder or not. The second is whether the test says you have the disorder or not. And this leaves four possibilities. You have the disorder and the test identifies it accurately. You have the disorder and the test fails to find it. You don't have the disorder and the test says you do. Or you don't have the disorder and the test correctly says that you don't. In the cases where the test correctly categorizes you, well, that's great. That's what we're looking for. The first metric, sensitivity, has to do with how good the test is at identifying a diagnosis when it's actually present. So we ask, if someone should be diagnosed with this condition, how good is this test at identifying it? A test with 80% sensitivity means that a person with that condition will be correctly classified as having the condition 8 out of 10 times. Some tests are more sensitive than others, and it seems like sensitivity would be really important. After all, you don't want to miss people who would benefit from a certain kind of treatment plan. What about the 2 out of 10 that the test missed? They won't get the treatment they need, which is a real problem. So, we should aim for tests that are highly sensitive. But there's a problem to watch out for. If I create a test for, say, narcissistic personality disorder that simply asks one question, do you drink water? If you look at the top row, I'm going to be accurately diagnosing everyone with NPD 100% of the time. In other words, my test would have maximum sensitivity. Of course, you see the problem here. I'm going to be saying that anyone I test has NPD, or whatever diagnosis I'm trying to find. I'll be recommending treatment for many people who will not benefit from it. And this is where our other measurement comes in: specificity. Specificity looks at how often people who should not have the target diagnosis get correctly ruled out. So now we look at the bottom row and say, if you don't have NPD, how often does this test indicate that? A test with 90% specificity would inaccurately classify someone as needing the diagnosis when they don't, only 1 in 10 times. In my drinking water example, the low specificity of 0% tells us that it's not a great test. Instead, you want a good balance between sensitivity and specificity to get the most accurate test possible. Too sensitive and you might sacrifice specificity. Too specific and you might miss some of those who should be getting treatment. So why does this matter? Well, if you go in for assessment and a test says that you have a disorder, that doesn't necessarily mean that you have the disorder. A negative test doesn't mean that you don't have it. This is true, by the way, for other kinds of medical diagnoses as well, like cancer. It's really interesting when you consider something called the base rate, which considers the proportions of people who are in each of the categories. Now, I live in San Antonio, Texas, which has just over 1.5 million people. Imagine that the state decided it was important to identify every person with, say, autism in the whole population. Now, we know from previous studies that about 1.5% of the population should be diagnosable, suggesting that there should be around 22,059 people who should be diagnosed in total. Now, autism assessment is usually a long and involved process, but there is a short test called the SRS that only takes a few minutes to administer. The SRS has been shown to have a sensitivity of around 90% and a specificity of around 90%. So let's see what would happen if we tested all 1.5 million people in San Antonio. The test would correctly identify 90% of those 22,000. So 19,853 of them. That's pretty good. But what about the remaining 1.48 million who are not autistic? If we test them, we will get 147,794 positive tests. Notice that the false positives far outnumber the true positives. For every one person correctly identified as autistic, there will be about 7 who would be classified as autistic who aren't. If you have a positive test, it's still far more likely that you're not autistic or don't have cancer or whatever is being diagnosed. This is because there are far more people being tested that don't need a diagnosis, that the incorrect tests outnumber the correctly diagnosed people. Now, in reality, we don't test everyone, which helps reduce this issue, but it highlights why no single test should be used to diagnose anything, and the expertise of trained clinicians is extremely important to help form a full diagnostic picture. So that's the idea behind sensitivity and specificity of psychological tests. If you found this video useful, don't forget to hit the like button, subscribe to get more videos on all things psychology, and until next time, keep thinking. Okay, time to test some sensitivity of some BuzzFeed quizzes. BuzzFeed thinks they can tell me whether I'm an introvert or an extrovert based on what kinds of potato foods I like. All right, let's give it a try. That's right, I am an introvert. Lucky guess, BuzzFeed. Let's try another one. Make mashed potatoes and we'll reveal if you're an introvert or an extrovert. Well, okay, let's see what we got. Add-ins, bacon. Holy shit.